Hi, good afternoon, everyone. My name is Connie Ash, and I am with Trudos Regenerative Technology, and I'm happy to be here today with Dr. Kelly Hood, who is recently added Trudos Technology to his practice. And we're here today to just give you a little bit of background about what Trudos is and some of the results that Dr. Hood has already seen from his patients. And so also too, if anybody has any questions, they can reach out to Dr. Hood's office directly, and hopefully we'll answer some questions about why this technology is going to have a significant impact in Dr. Hood's practice. So welcome, Dr. Hood. How are you today?
Hey, Connie, doing good. Thank you for having me. I started asking questions about, the true dose, and it was measuring before you did a blood draw for doing regular PRP. You're measuring the platelet count, and then you're getting the accurate dose for the true dose. And that's kind of where this name comes from, the true dose. And then seeing the difference from the old PRP to the new PRP on a slide, microscopic slide that actually shows the platelet count and where we used to be versus with the true dose. It was like absolutely off the chart, crazy more concentrated. So therefore, the more concentration that you can get back into a site-specific area, such as a knee, because we treat a lot of bad knees, then the much better results you're going to get because of the significant concentration value. And that's why, I brought it on my practice, and we have already seen some very significant changes for some really bad knees. So it's very exciting.
Yeah, that is really great news. And that's why we call it true dose technology, because we know that there's actually scientific literature that says in order for healing to start, you need 1.5 billion platelets per milliliter that is injected. And most of the centrifuges that are available in doctors' offices today, they can't reach that high of a concentration. And so what Trudos actually does is we actually provide quality control and standardization in your practice and for your, and we've actually elevated it from PRP, and we actually call it platelet therapy because it is a double spin procedure that's done, and it provides actual validation of what the actual dose is the patient is getting. So, your typical patient would come in and they'd get a finger prick to determine what their platelet count is that day, today, say. And then once we get their platelet count, we then go and put it through proprietary software that you have access to. And it tells us how much blood we need to draw to actually get into that therapeutic concentration of 1.5 billion and per ml. And why that is so important is because of another picture that I'd like to share with you. The healing cascade is very important to learn about, is because it's the way your body heals, whether it's a paper cut or a traumatic brain injury. And what happens is it's the platelets that are in your body that are out there like drones in your body, looking and surveilling for injuries, for any type of pathogen, bacteria, or virus. And they're the ones that actually control this process. And that is why for many years, people, physicians like yourself, Dr. Hood, have been using PRP to help repair those site-specific injuries of, joint issues and tissue injuries and things like that. But what happens is it's right now, it's been a 50-50 proposition because you don't know what the patient's platelet count is. And an average platelet count ranges between 150,000 per microliter and 400,000 per microliter. And therefore, if you're not testing patients, you do not know what their platelet count is. And so you actually just treat everybody with the same volume of blood that you draw. So now with Trudos, now that you know what the patient's platelet count is on the day of treatment, you're able to customize it for every patient to be able to pull the amount of blood necessary in order to get a minimum of 1.5 billion platelets per milliliter that is injected into that injured site. So, and this is what the healing and what happens when that is injected, when the platelet therapy is injected into the injured site, your body inherently knows how to heal itself. And you get this big bolus of platelets that are rushed into your body. And they basically No, your body inherently knows how to heal and where that chronic injury is. And it sort of kickstarts that healing cascade all over, because that's what happens, is that your body only allows so much time for an injury to be repaired. And then what happens is you stub your toe or you hit your head and another injury occurs and resources have to go someplace else. So therefore, you need something to go after that chronic injury to get that repair to make started again. Does that make sense?
God, that's what you just said there. Yeah, that's why there's so many Americans that are in chronic pain because, let's face it, in our culture, when we have pain or we have some kind of an injury, the natural instinct for people to do is what? They grab a pain suppressing something.
Yes.
And that right there is immediately interfering with the body's natural way of healing. So then they might quiet that down. Then, like you just said, something else happens to them, to another area of the body. And then the body gets shifted or the brain gets shifted to trying to help heal that. And then the cycle starts again because what most people do, they grab more pain meds. And that's why our country got into a huge dilemma with narcotics and pain relieving drugs, is because the body tends to kind of, it gets addicted to that. So now with, understanding better, because, we're always understanding things better. And that explanation that you just did was very good. And hopefully that slide made sense to people. And if they're watching this recording, they can actually pause it and kind of look back over, because that's a very, very important thing to understand about how the body knows how to heal if given the opportunity. And true dose with, go ahead.
No, go ahead.
Yeah, with true dose, just having that true platelet, count. And a great example is like this past Tuesday, we did several patients in my office, and one of the gentlemen had a much lower platelet count than even, and he was probably in his 50s. And we did another lady that was in her, I think, mid 80s, and his platelet count was lower than hers. So he would have been the guy that would have completely failed with the traditional PRP, because we would not have even gotten close to a therapeutic dose of platelet-rich therapy by doing it the old way. The new way, right.
And you wouldn't even known
he has already, he's already felt significant changes with his hip already, because we got such a tremendous concentration into his hip.
That's awesome. And you know what? And like you mentioned before, that if the old way, you treated everyone the same. Now you're able to actually individualize it per patient. And I just wanted to point everyone's attention to the picture that I have on the screen is when this is the PRP that Dr. Hood used to offer in his practice, regular PRP. And if you can see there, you can see small little yellow dots. And those little yellow dots are actually platelets that are highlighted in the PRP that we actually created in Dr. Hood's office about a month ago.
Connie, that's actually my blood.
Right. So we did. So actually Dr. Hood went underneath this process, did a finger prick, and we did a baseline count. And then we used his old system and said, okay, basically this is the result for the PRP that Dr. Hood was going to have injected into himself. Basically, the typical centrifuges that are out there right now that people are getting treated in other offices, they basically will produce one time the patient's baseline platelet count. So if a patient comes in and they have a platelet count of 200, when you go and spin it down and you pull off the plasma that they assume that they're going to inject, that plasma will probably be a little bit above that, say maybe 210, 220. It's just not as powerful as the new centrifuge and the system that Dr. Hood has brought in. So what we did as well is we did a comparison, kind of like, a soft drink challenge like in the past, if you can tell the difference. And we just used the same blood, same process. But what we did is we used a double spin centrifuge, the new equipment that Dr. Hood has in his office. And the new equipment that Dr. Hood has in his office produced this. So this is, and again, the yellow is the highlighted platelets. I'm going to make this a little bit bigger so everyone can see this. Look at all those additional platelets that Dr. Hood was able to get injected into his body to actually kickstart a healing cascade for a site-specific injury or for a systemic release. I mean, that's pretty impressive, wouldn't you say, Dr.
Oh my
Hood?
gosh, yeah, significant night and day difference. And again, kind of that's why we're getting such very, very good results with this new TrueDose, because it's the concentration that is so powerful for these old chronic injuries. So yeah, I'm very, very excited to have it. Hey, let me show you something else. Then we'll probably start wrapping up here. I'm going to see if we can see this.
I'm going to stop sharing my screen.
Okay. Can you see that? I'm having to cover my face. Can you still hear me?
Yes.
All right. Can we see the joint space, the knees? Can we see
Yes.
that? Okay.
Yes.
So this is what is considered bone on bone knee degeneration. Okay. This is, advanced phase 3 approaching phase 4 degeneration. So in the medical world, that is considered bone on bone. So this lady came in, I believe late January, early February, had no choice because the medical profession would not operate on her because of her, just some comorbidity factors. Her overweight. She has some other factors that they just felt like it was not worth putting her on the surgery table to have replacement because she might not live through it. So she came in with her husband and saw something on Facebook, brought her in. We discussed the TrueDose, and I will tell you that her right knee is completely pain-free. Her left knee is 80% improved, and that's been holding out for, let's see, this is late March, so almost 60 days, and she is extremely ecstatic. And like you said earlier, Connie, the healing cascade is, really going to town, and it's helping repair and regenerate, some extra, better blood flow, and that brings in better nutrition, and that's giving her life back. So that is significant change and very, very happy patient.
What also is good to note here too is that the 1.5 billion helps to regrow microvasculature, like you just mentioned, to revascularize that tissue, to bring in nutrients there. But it also does something else. The platelets also signal at this particular point in time for the patient's own stem cells to come to that area to help regenerate and to help heal that area. And that's probably, this is probably a really good time, and that's probably why she's feeling so good and the pain relief is gone. So I'm really happy to hear, and we really love to hear all those success stories. Will you be sharing her story on your Facebook page? That's Hood Health and Wellness, correct?
Yes, that should come online. It probably, if not late April, it might be into May, because we just have several other ones that are in line, but she will definitely be one that we put on there.
Well, that's good news. And I'm really excited that Dr. Hood, that you've decided to join the Bridging Biosciences family and to add TrueDose technology to your practice. I know that you've got several patients that have been treated and have some amazing results, and I'm looking forward to other success stories, not only for those patients that have, site-specific, but also those that suffer from autoimmune. And we can do that in another Zoom call and another meeting, but that's really exciting. And if your patients want to hear more about how they can really have an opportunity to get their autoimmune disorders under control, I'm looking forward to talking with you again about it.
Oh, very good, Connie. Thanks so much for having me on.
All right. Well, you have a great rest of your day, Doctor.
All right. Bye-bye.
Bye.